I want to speak about biosafety in laboratory. Anyone see this figure before? What is referred to?
Hazard.
Yes, very well. What is biosafety? Biosafety is the application of safety precautions that reduce the laboratorial risk of exposure to potentially infectious microbes and limit contamination of work environment and ultimately the community. The most important thing in the laboratory is your health. Your health is more important than anything. You should first be healthy and healthy inside to the laboratory and go out healthy from the lab. According to WHO, biosafety is a strategic and integrated approach to analyzing and managing relevant risks to human, animal, and plant life and health and associated risks for the environment. We have three important concepts in the field of biosafety: biological hazard, biocontaminants, and bioprotection. Biological hazard refer to potential risk of uncontrolled exposure to biological agents with infectious capacity harming the individual. Biocontaminant refer to the measure used to prevent infectious diseases from leaking from the research center to the other place where they may be produced. Bioprotection refers to measures taken to reduce the risk of loss, theft, misuse, or intentional release of pathogen and toxin from laboratory to the out of the lab. What are biosafety levels? You may hear about biosafety level. We have 4 biosafety levels. A biosafety level or pathogen protection level is a set of biocontaminant precautions required to isolate dangerous biological agents in enclosed laboratory facility. There are 4 biosafety levels. The biosafety level range from biosafety level 1 to biosafety level 4. Each level has a specific control for contamination of microbe and biological agents. The primary risks that determine level of contaminant are infectibility, severity of disease, transmissibility, and nature of the work conducted. The origin of microbe and the route of exposure are also important. In this figure, you see biosafety level 1 to biosafety level 4. Biosafety level low-risk agents are categorized in biosafety level 1, like E. coli. E. coli is safe microbe that is everywhere. We should use biosafety level 1. And you see, every we go to the up of this pyramid, biosafety level 4 has highest risk. It's referred to infectious aerosol transmission that may cause serious or lethal infection with no treatment available. When we use with this agent, we should protection in biosafety level 4. Ebola virus, Varroa virus, and Marburg virus are viruses that we don't have treatment for this agent, and we should work in biosafety level 4. In our lab, we work in biosafety level 1, and there is no danger for you. In this chart, laboratory practice, safety equipment, and facility construction are here to. For your information. I don't take it in your exam. For example, in biosafety level 1, work can perform on open lab bench or table, like our laboratory. Personal protection equipment or PPE, like lab coats, gloves, aid protection are needed to wear in biosafety level 1. For example, in biosafety level 4, we need more protection, personal protection equipment. In our lab, we should always wear lab coat. Lab coat is the holy garment of your job. Wearing lab coat, it is mandatory from the time of entering the laboratory until the completion of work. Everyone should wear lab in a clean coat with button closed. Don't open your button in the lab. Biosafety in this laboratory. Another thing you should memorize is the skin is the way of transferring pollution to the body. Use of gloves during experiment is integral part of working in the laboratory. Please use disposable gloves that are placed on your bench every session. You should wear these gloves. The laboratory environment is completely contaminated due to work with all kinds of viral, microbial, and antigenic samples. Therefore, such place is not a place to eat, drink, or smoke. avoid consuming any of food or drink in the laboratory. Biosafety in this laboratory, the possibility of contaminating your personal belongings in the laboratory is easily available. Do not put your mobile phone, glasses, bag, laptop, and any additional equipment on the desk, please. Your work desk in the laboratory from beginning to the end of work is your workplace. Please keep your workplace tidy and work your surface clean during the test. After biosafety, we go to our test. First test I want to teach you is ring precipitation test or interfacial test. What is the objective of ring precipitation test? To detect antigen and antibody complex and detect antibody in the patient's serum, which can be used to diagnose this disease. In disease, we can find the agent, microbe, or the antibody that produced against the microbe. You know, our immune system produces antibody against antigen that enter our body. The body produces antibody, and we can detect this antibody from this test to diagnose the disease. In diagnosis in immunology, many tests based on the interaction of antibody and antigen and have developed to determine the presence of antibody or antigen in patient. The ring test or precipitation ring test is simple serological for illustrating the precipitation reaction in solution. It is a quick qualitative test for the presence of antigen and antibody complex. Anyone see this figure before? Can you explain about this?
The first one is zone of access and antibody, but the second one is equalization between both antigen and antibody, and the third one is access antigen.
What it means?
This means that the first one there's more antibody than antigen. So it's the beginning of the process, while the second one they will attach to each other, so the amount will be equal. And the third one is mean that we put a lot of antigen, more than enough, so we will get that result.
Very good. We have three zones in antigen and antibody reaction. Prozone, zone of equivalence, and prozone, zone of antigen excess. For see the antigen and antibody reaction, the amount of antigen and antibody should be equal to C and precipitate. If the antibody is more than antigen or antigen more than antibody, the precipitation reaction is not occur. In ring precipitation, you should add antigen and antibody the equal volume to see this ring test. In this test, and in today we see this ring test, this zone of equivalence that we can see with naked eye. You see it here. If antigen is exceeds over the antibody or antibody exceeds to antigen, we don't see precipitation line. For procedure this test, antiserum is placed in the bottom of the test tube, and then antiserum is placed in the bottom of the test tube, and then antigen are gently layered above the antibody solution. Look at it. Put it gently to see this reaction. Immune complexes will be visible as a whitish ring in the interface. Observation and result of interpretation. Positive ring test and we have negative ring test. When we have positive and when we have negative test. In positive ring test, observation of white ring at the junction of antigen and antibody reaction indicate positive result. And absence of white ring formation means negative test. See, this is ring test that take place here and here. There are positive ring tests. Next test I want to teach you is immunoelectrophoresis. First, you know, when the microbe enter our body, a specific colony of B cell detect this antigen. After detect the microbe or any antigen like virus, bacteria or other agents, the B cell will be active and then produce antibody specific to this antigen. Only one colon to that recognize specific this antigen or produce antibody, and the antibody are the same. Every antibody that produce this that produce against this microbe are the same and from one colon. We call them monoclonal antibody, that against specific to this antigen. Immune reaction means the reaction between antigen and antibody. You know, antibody is specific to antigen. For example, this antibody only recognize this antigen and don't recognize other antigen. The antigen-antibody reaction are high specificity. Antigen binding site of the antibody molecule perfectly matched to the antigen, like K in the hole. Anyone know about epitope? What is epitope?
Surface of
The
antigen.
specific part of the antigen at which the antibody attaches.
Yes. You know, an antigen have some epitope. Antibody only bind to a specific site of the antigen. We call it epitope to this region that match to the antibody. For example, in this antigen, you see, have two epitope that will two different antibody match to the epitope of one antigen. One antigen can be many epitope that many antibody detects only a specific region of the antigen. Next, we want to speak you about monoclonal and polyclonal antibody. Polyclonal antibody derived from different B cell colons, and monoclonal antibody derived from a single B cell colon. Polyclonal antibody, each one recognizes a different epitope on the same antigen, but monoclonal antibody only recognize a single epitope per antigen. We have monoclonal and polyclonal gammopathy. What is gammopathy? Gammopathy, disturbance in synthesis of immunoglobulin. We have polyclonal gammopathy and monoclonal gammopathy. In polyclonal gammopathy, heterogeneous increase in immunoglobulin involving more than one cell line, caused by the variety of inflammatory infection or neoplastic disease. In monoclonal gammopathy, proliferation of one or more clone of different B cells that each produce an immunologically homogeneous immunoglobulin. All of these immunoglobulins like each other, caused by multiple myeloma malignancy of IgG secreting plasma cell or Waldenstrom macroglobulinemia hypersecretion of IgM. They are the diseases that produce monoclonal gammopathy. When we electrophorese serum, we have this image. You see, when we electrophorese in the gel, each protein of serum separate to each other. You see, the most abundant protein of serum is albumin. You see sharpest bond here. And you can memorize this. Albumin is more than other antigen. It is sharper bond than other, and we have alpha, beta, and gamma globulin here. You see here immunoglobulin in this bond. Any antibody produced in this bond. If we have gammopathy, this bond is sharper than normal. Okay? Any question here? Ask. Take it easy.
If gammopathy, what will happen here, sir?
In gammopathy, this is increased in, and the bond is sharper than normal. This protein is increasing, and we can see that we have a gammopathy. Next, we want to say about immunoassay. Immunoassay, a biological assay for measuring the presence or concentration of macromolecule or a small molecule through an antigen and antibody. What is analyte? The molecule that was detected or qualified by immunoassay. What is signal? Something that can be understood by our sense. Analyte or signal. Here see an antibody that labeled with a signal. It produces color, for example, for us that we can detect antigen and antibody reaction. Analyte can be antigen or antibody. See here. Biological assay are divided to the categories and divided to several categories. Here, analyte and make signal to us. For example, if the signal is visible, it can and detect with naked eye, it categorized as visible signal. If the signal produce color, we can use colorimetry test to detect the color. If the signal produce light from luminometry, we can detect the light and the signal. If the signal produce a fluorescence from fluorometry, we can detect the signal. Classification of immunoassay. We have six types of immunoassay. First, precipitation immunoassay, agglutination immunoassay, radioimmunoassay, enzyme immunoassay, fluorescence immunoassay, chemiluminescence immunoassay. What is different between precipitation and agglutination? In this figure, you see agglutination and precipitation. These two types of tests have similarity to each other. In each of tests, antibody clustering antigen and form antigen-antibody lattice. But these two types have difference. Physical form of antigen. In precipitation, we have soluble antigen, but in agglutination, we have particle antigen. Here you see, we have a particle antigen that's called agglutination. Here we have soluble molecule. In this reaction, we call them precipitation. Right? You want to write? Complete your writing?
Only the most important.
Type of precipitation immunoassay. We have qualitative in liquid phase like ring test. We have qualitative semi-liquid phase like double immunodiffusion, counter-immunoelectrophoresis, and immunoelectrophoresis. And we have semi-quantitative like SRID and rocket immunoelectrophoresis, and we have quantitative immunoassay. We can count it, like immunoturbidometry and immunonephelometry. Here we speak about qualitative immunoprecipitation. We have double immunodiffusion or DID or Osterlony method, and counter-immunoelectrophoresis or CEP, and we have immunoelectrophoresis. First, we want to speak about double immunodiffusion or DID or Osterlony method. Here in the gel we have two wells. In one well we coat antibody and another well we coat antigen. In the zone of equivalence, when the antigen and antibody reach each other, we have a precipitation line, and we can see this reaction that this antibody is specific for this antigen. If the antibody is not specific to this antigen, we don't see the precipitation line. For accelerate this test, we use counter-immunoelectrophoresis. We use voltage to accelerate this test. In this test, we also have a precipitation line that we can see antigen and antibody reaction. And we have immunoelectrophoresis. In immunoelectrophoresis, the antigen mixture is first electrophoresed to separate in component by charge. First, the antigen is coated in this well and separate by charge. We use voltage to separate this antigen. And then trough are then cut into the gel parallel to the direction of electric field. We use this trough and add antibody. Next, antigen and antibody go to each other, move to each other, and we have precipitation line. First, antigen in first phase separates by the charge. You see, we have many antigen in one sample. See? And then when we use antibody and a specific antibody to each antigen, move to each other, and we have a precipitation line for each antigen. See? We see this line that means precipitation line between any antigen and antibody. Here we want to use immunoelectrophoresis. For using immunoelectrophoresis, normal serum is coated in this well, and serum of patient with IgE deficiency, for example, or any gammopathy are coated here. And in this trough we add anti-human antibody, the antibody against the antibody of patients and normal serum. With comparing this bond to the normal serum, with the patient, we can detect the gammopathy. Here, see, everything are the same, but in IgA deficiency, we don't see the bond of IgA. We can know that this patient has IgA immunodeficiency. See, we are here immunoelectrophoresis of serum, anti-G. Here is normal and it is not normal. We have poly-IgG gammopathy. And here, anti-kappa of light chain of antibody, you see, not normal. And it means we have a gammopathy. By using and perform this test, we can know the gammopathy. We have two gammopathy, monoclonal and polyclonal gammopathy. In polyclonal gammopathy, we have many clonal B cells that produce many type of antibody. We have see many bonds here. But in monoclonal gammopathy, we see only one bond. That it is monoclonal antibody, specific against one antigen. But in polyclonal gammopathy, we see many bonds here. Next, we want to speak about ELISA test, enzyme-linked immunosorbent assay. What are immunoassays? Immunoassays are the tests rely on the interaction between antigen and antibody in the laboratory setting, not in your body. Antigen and antibody are categorized into primary and secondary. Secondary are visible with naked eye, but primary need and chromogen, fluorescence, anything signal to detect it. Immunoassay, we have several immunoassays: radioimmunoassay, immunofluorescence assay, and ELISA immunoassay. In secondary antigen and antibody, we have agglutination, precipitation, and folliculation reaction. We speak about this. Next, we speak about enzyme-linked immunosorbent assay. What is enzyme?
Which catalyze the biological process. Is a protein which catalyze the biological process.
Anyone else? What is enzyme?
Enzyme, it's a biological catalyst. It means it's speed of the biological reaction, but it's not involved in the reaction.
You want to speak? Thank you for your participation. An enzyme is a biological catalyst and is almost always a protein. It speeds up the rate of a specific chemical reaction in the cell. The enzyme is not destroyed during the reaction and it's used over and over. What is the substrate of enzyme?
Biological molecule.
What's a biological? Here, see, we have here an enzyme and substrate binding here. Substrate when bound to the enzyme produce product and degrade this substrate. Here, every enzyme have its specific substrate and produce product. In ELISA, we use enzyme to detect antigen and antibody reaction. Here, see, we have a capture antibody and our target antigen are coated to the capture antibody, and we use a secondary antibody that have an enzyme. Then we add substrate to our mixture. This substrate produced by enzyme to the product that this product make color for us. By changing the color, we can detect antigen and antibody reaction. What is the application of ELISA? ELISA is a common laboratory testing technique that detects and counts certain antibody, antigen, protein, and hormone in the body fluid sample. We can use ELISA to detect antibody like HIV, antibody that body produce against HIV. We can detect antigen, we can detect protein like cytokine, hormones, and we can like T3, T4, and beta HCG. In performing ELISA, we have four main general steps. First is coating. First, we should coat the antigen in the well. For ELISA, we use this well. It have 96 well in this plate. See? For example, it is a well. First, we coating, adding an antigen or antibody. For example, I add an antigen that coats in the bottom of the tube, in the well. Okay? It is antigen. Look, here antigen are coated in the bottom of the well. Then we wash. Any antigen that not bind to the well or in this washing go out from the well. Okay? In step 2, we use blocking. Here there is a space that can another antigen bind. To avoid binding any antigen, we use blocking first. In blocking, we use BSA, bovine serum albumin, that attached here and avoid to attaching another antigen. Now blocking is complete. Then we wash again. And next we use a detection. In detection step, first we add an enzyme that binds to the antigen. This antibody, we add antibody. This antibody is conjugated with an enzyme. Here is an enzyme that conjugated to the antibody. And then we have a wash again. If antibody not specific to this antigen, for example, have this shape, it's not attached to the antigen, and in wash it go out from the well. Next, we add substrate. We add a substrate. Substrate here, enzyme degrade the substrate to the product. The product change the color of our solution. For example, before adding, always substrate is colorless agent, and after adding the substrate, its color change, for example, to the blue color. And we know that the enzyme that binds to the specific antigen that detects the specific antibody that detects antigen produce color for us. We use different enzymes in this test, like horseradish peroxidase or HRP. Substrate for horseradish peroxidase is H2O2. We have an enzyme HRP that degrades H2O2 to water and oxygen. See? After we add a chromogen. What is chromogen? A product that
Color gives substance.
make color for us. We use TMB for horseradish peroxidase. TMB reacts with O2 and produce a blue color for us. After we add a stopping buffer, the reaction is complete we should stop the reaction. We use an acid like H2SO4 or sulfuric acid to stop the reaction. When we add a stopping buffer, the color changes from blue to yellow. After we read the color, we have 4 types of ELISA. Direct ELISA, indirect ELISA, sandwich ELISA, and competitive ELISA. We speak about each other. First, we speak about direct ELISA. You see, in direct ELISA, we coat antigen in the bottom of the well, and then we add an antibody that conjugated with HRP enzyme. Then when we add substrate like TMB, the enzyme produces the color that changes the color of this substrate. Here, see, from blue to yellow. It means that antibody specific to antigen bind to the antigen, and the enzyme product substrate to the product, degrade substrate to the product, and make color to us. In indirect ELISA, we coat an antigen and add serum. If in the serum we have an antibody specific to antigen, antibody bind to the antigen. Okay? And then we use a secondary antibody against the Fc region of the antibody. This secondary antibody is conjugated with enzyme, and then when we add substrate, it produces color to us. Okay?
Okay.
In sandwich ELISA, what is sandwich ELISA?
Sandwich.
In sandwich ELISA, antibody first coated in the bottom of it. In this, we add antigen. Here we coat antibody. And then wash to exit any antibody that's not attached to the well. Then we add antigen. If the antigen is specific to the antibody, it's attached to the antibody. See? Then we add secondary antibody that conjugated with enzyme. It's like a sandwich. 2 antibody sandwich, antigen, an antigen. Like 2 bread and this hamburger. And then if we add a substrate, it produces color to us.
Substrate on H2.
And you have questions?
No, sir.
Anyone understand sandwich ELISA? Today we perform this type of ELISA. And we have a competitive ELISA. It's different from the other ELISA methods. In competitive ELISA, it's a compete between a conjugated antigen with enzyme and our sample. If sample include low level of target protein, it's not compete with this labeled antigen, and it produce more color because the antigen that's conjugated with the enzyme are more than our sample that not conjugated with enzyme. And if sample have high level of target protein, it can win the compete between the conjugated enzyme. Then if we add substrate, here we have more enzyme than here. And then it produces more color than this. If we have more sample, high level of target protein, it produces low color to us. And if we have low level of target protein, it produces more color for us. Today we perform ELISA, and ELISA kit have this agent. First, we have a sample. In traditional kit, step 1 is performed. See here, we have 4 steps of ELISA: coating, blotching. In traditional kit, these 2 steps are performed before in the company. And we have a traditional kit that do the test from
Detection.
level 3 to level 4. For perform this test, first adding the sample. In the sample, serum are added to the well. Here you see we add sample to the well. Then we have incubation to give time to bind the serum sample to the well, and we have washing, then we adding conjugated antibody, and then we have an incubation, and then we have a washing phase, then we adding a substrate that it is H2O2. Conjugated antibody have enzyme that produce
Always
oxygen from this H2O2, and chromogen that there is T and B make color to us. And then if we incubation this test in the darkness, it produce color to us. It produce first a blue color, and after adding a stop solution like H2SO4, it
Yellow.
produce a yellow color. And we have a control positive and negative. In control positive, we sure that we have the agent that bind to the antigen. In negative control, we are sure there is no antigen-antibody reaction. And also we have a standard solution that are serial dilution of control positive. To comparing this standard to our sample. Then we have an ELISA reader that we can detect the optical density of the color produced by enzyme. This reader, by using this, we can quantitative our test. We say that we have a standard solution. A standard solution gives this curve to us. It is optical density and it is our product. For example, HIF1 alpha protein. If we have more color, it means that we have more protein in sample. It is our standard sample, but comparing the standard sample to our sample, we can quantitative our sample. For example, we have standard here. We have serial dilution of a standard. For example, 1,500, 250, 225. We know that this standard have the antigen and antibody reaction, and we have a sample here. By a standard amount, we draw this curve. And for example, it is optical density, the density of color in this border. See, if our sample have OD like this, and we have a standard here, by comparing the sample OD with the standard, we can quantitate the test, this test. Anyone have a question?
No, sir.
Sir, how we can find OD?
OD can read what this ELISA reader. In the reaction, it produces color. Different color are produced. If we have more sample in our serum, it produces more color. And if we have low level of sample, it produces low color. Okay? We have an ELISA reader that detects the amount of color, optical density of the color. It tells us the density of color to us. But comparing this to the standard, we can quantitate this test. Right? Draw this to the left. For example, we have sample 1, sample 2, and sample 3. Look. In sample 1, we don't have antigen. In sample 2, we have low amount of antigen. In sample 3, we have high amount of antigen. Okay? We want to detect how amount of antigen that we have. We perform ELISA. We perform sandwich ELISA here. In sandwich ELISA, antibody coated bottom of the tube. Here you see. When we adding sample 1 to this tube, there is no antigen to bind to the antibody. See? In sample 2, only one antigen, low amount of antigen bound to the antibody. In sample 3,
A lot of it.
high level of antigen bind to the antibody. Next, we use detection antibody or secondary antibody. Secondary antibody are attached to the enzyme. Here we have only enzyme that attached to this secondary antibody that attached to the antigen. Okay? And here we have more enzyme than here. Look,
Yes, sir.
here we don't see any color change. It don't produce color to us. Okay? In sample 2, we have low amount of color or low OD, optical density. In sample 3, we have high optical density. We have a standard that produce no color, moderate color, and high amount of color. But comparing a standard to the sample, we can quantitative the. Okay.
Yes, sir.
Sir, so this test is measuring the number of antigens.
Please.
This
Again.
test is used to measure the number of antigens.
This test can be performed for detecting antigen and antibody. The sample may be antibody. We can perform an ELISA that detects antibody. We can use ELISA for detection hormones, cytokine, antigen, antibody. It's a versatile test that we can do it in the lab. That you answer, and then we should perform practical section of your exam.
वो इसलिए क्या कोडिंग पे जाके ना इंजन वाले क्लास से तैयार होगा 14 क्वेश्चन आएगा
It's easy, don't worry about exam.
دخلي نهارات.
Don't worry. You have easy question that
امیدوارم که آسان باشه.
everyone pay attention in the name of Allah. In next session, we speak about Wright.
कल वाले हैं
What? We speak about Wright, comes Wright and 2ME Wright test, and then we speak about latex agglutination test. That we have two types of this test: C-reactive protein test and rheumatoid factor test. We have a serological reaction. Serological reaction refers to antigen and antibody reaction. It's divided in three subgroups. Precipitation reaction when the antigen is solvent. And we have agglutination reaction when the antigen is insoluble particle. If the insoluble particle is RBC, we have an agglutination reaction. And we have flocculation reaction when antigen is colloidal particle. Now we want to speak about agglutination reaction. Agglutination reaction are divided in three subtypes. We have active or direct agglutination when antigen are found naturally on the particle, such as Wright and Vidal test. We have indirect agglutination when we use anti-human globulin, and we have passive agglutination when the particles are coated in soluble antigen. We speak about this. We have a disease named brucellosis. You hear about
Yes.
What is this disease?
This is
it is micro
So, the zoonosis. Zoonosis disease means the disease that
from animals it can be
animals to
transmitted.
humans.
Whooping cough.
and it is microbial disease sir
Symptoms are whooping cough, sir.
Brucellosis zoonosis caused by ingestion of unpasteurized milk from infected animals or close contact with their secretion. You should always boil the milk to avoid infect with brucellosis. It's also known as indolent fever. Everyone be quiet, speak, don't speak. It's also known as, pay attention please. After class we speak to each other, now only listen. It's also known as indolent fever, mild fever, and Mediterranean fever.
Malta.
We have 4 species that infect human. Brucella abortus from cattle to human, Brucellus canis from dog to human, Brucellus melitensis from sheep and goat to human, and Brucella suis from pig to human. See, it is Brucella abortus that can infect human, Brucella melitensis, Brucella canis, and Brucella suis. Symptoms of brucellosis. We have fever, chills, loss of appetite, sweats, weakness, fatigue, joint, muscle, and back pain, and headache. This bacteria can separate in many organs of the body, and you see this particle bacteria in our secretion here. You see. For diagnosis brucellosis, we have 2 tests: non-serological test group and serological test group. When we want to detect the antigen or detect the own Brucella bacteria, we use non-serological test. We use blood culture, stool culture, urine culture, CSF culture to detect the antigen. In some tests, like serological tests, we don't look for the bacteria. We look for the antibody that produced against antigen.
Got it.
Here we look for the antibody that produced against brucellosis. Why we use serological test? In some stage of the disease, we can't detect the bacteria of brucellosis. Bacteria is hidden in organ and it's not detectable. Now we use serological test. You know, the immune system produces antibody against every antigen that encounter our body system. In serological test, we can perform Rose-Bengal test, Wright test, Combs-Wright test, and 2 Mercator-Ethanol test. We speak about this serological test today. First, we speak about Wright test. Wright test is active agglutination test. What means active agglutination test? When the antibody detects the own antigen, that antigen is a particle. Now we have an active agglutination test. That antibody directly recognizes the antigen, and then it's make a cross-link between this antigen, and we have a precipitation or agglutination here. When the antibody links between the antigen. For Wright test, we have 2 different types of tests: a slide method that performing the slide, or tube method that performing the laboratory tube. What is different between these tests? We have an slide test named Rose-Bengal test. Rose-Bengal test or buffer brucellosis antigen test is a rapid slide agglutination procedure. For perform this test, we add patient serum. Patient serum have antibody against brucella, and if we mix this patient serum with Rose-Bengal antigen, this reagent have antigen against antigen of Brucella abortus. This reagent have Brucella antigen abortus. And here we have an antigen-antibody reaction. We can see. Here we have a positive reaction, we see agglutination. In here we don't see any agglutination. That means we have a patient and healthy here, but comparing this negative and positive. After we perform a slide test, to perform the titer of the amount of antigen, we use tube Wright test. If the Wright slide test is positive, then we perform this test. Tube Wright test is done to determine the exact titer of a specific antibody against brucella in the serum. For perform this test, we perform this test today in the lab. Look and learn about this test. For perform this test, we put, for example, 5 tube, number 1 or 6, for example. No difference.
No difference.
Number 1 to 6. Then we add 0.9 physiological serum to tube 1. Here we add 0.9 physiological serum to tube 1. To the other tube we add 0.5 amount of physiological serum. Why we use this test? For serial dilution of this. Next, we have the patient serum. In the patient serum, we have antibody against Brucella antigen. We add 0.1 ml of patient serum. Now, we have 1 ml in this tube, okay? We have 1 ml, that's 0.0 ml of is patient serum. 1 to 10. It's the dilution of this tube. Now, only we have 1 ml, okay, in tube 1. We add half ml to the tube 2. From tube 1 to the tube 2. Now we have 1 ml in tube 2 and half ml in tube 1, okay? And like tube 2, add it to the tube, other tube. When we use this, therefore, we have serial dilution of this amount of patient serum antigen, serum antibody. Next, we add antigen. Half ml of antigen add to the all of the tube. When adding the same amount of antigen is we have 1 ml here, that half ml added to this tube. Now we have half ml, okay? When we add half ml antigen to this tube, we have now 1 ml, okay? And add antigen to the same tube. We have now dilation of 1/20 to the tube 1. And the next tube we have dilution of, I write with the green color. We have it's a dilution of the anti-serum in this tube. In this tube we have 1/04 or 1/4. In this tube we have like other.
Sir, what do you mean by dilution of serum? What do you mean by dilution of serum?
Serial dilution. We have serial dilution. In this test, we want to measure how amount of body product against the antigen. If the body produce more antibody, in this test we can detect. In this test we can know about the stage of the disease. In some stage of disease we produce more amount of antibody. In some stage we produce low level of antibody. See? Now we have serial dilution. Okay? I explain it again to understand. We have serial dilution of this. See? And when the last tube, when we have agglutination, we read this. Okay? Report of Wright test tube, the last tube with agglutination. For example, the last tube that we see agglutination is here. We see agglutination in this tube, in this tube, in this tube, in this tube. But in two last tube, we don't see agglutination. Based on WHO in Iran, titer equal and more than 160 are considered clinically positive. if we have the agglutination in this tube, it means that this patient have the brucellosis disease. We use serial dilution to detect it. Understand?
No, sir, this portion. This portion. Can you repeat this one? Yeah.
Repeat it.
Yeah. And change the slide also. Yes.
We make serial dilution of patient serum in different tube.
Okay.
Okay? To amount, here we add only 0.1 ml of patient serum to tube 1. Okay? Next, from this tube we add half ml to the tube 2. Okay? And from tube 2 we add half ml to the tube 3. In this serialization, every we go to the forward, it's low level of patient serum. It have tube 1 have high level of patient serum, tube 6 have
Lowest.
low level of patient serum. Okay? But we add same amount of antigen to the all of the tube. Look, every one we add half ml. See?
Yes.
It means that this tube have higher amount of patient serum that have antibody. Okay? It means refer to the concentration of this. Okay? It have low concentration, it have high concentration of the antigen.
Sir, what do you mean by physiological serum? Like
What is physiological serum?
What's the content in physiological serum?
We use physiological serum for performing tests in the, we need a liquid phase that physiological serum made it for us. Antigen and antibody have low amount. For have a liquid phase, we use this physiological serum.
So it is with antigen or without antigen, sir? Physiological serum.
Physical don't have antigen and antibody.
No.
It's physiological serum with saline and water,
Just
nothing else. Okay? It mimics the serum plasma. Okay? We want to react this test in this physiological serum phase. Okay? Everyone understand?
Yes, sir.
After performing Wright test, we perform 2 MV Wright test. You see in brucellosis curve disease, we have an acute phase and chronic phase.
How to find
ml from this and from this. 0.1 ml from this sample have low amount of antibody compared to this.
Yes.
Okay, it is different between tests.
Yes.
Understand?
Sir, here
You, I was.
here the antibody detection will be higher in the sample one.
In sample 2, we have high amount of antibody against brucella.
In slides.
In first
In first slide, the tube number 1, we can have a higher amount of antibody, right?
it will be the most concentrated one.
We have, it's the protocol of test. For example, in this test, if we have low level, we see agglutination only in 2 first tube. Okay? If we have high amount of antibody, we can see agglutination until this tube. Okay?
A little bit,
We have about triple positive over
say,
Okay, understand.
Yes.
Wright test. For detect the subtype of antibody against brucella, we use 2 MV Wright test. You know, in acute phase of the disease, first antibody that immune system product is IgM. And then body produce IgG. Okay? In the first step of disease, that is acute phase, we produce IgM, our body. And the acute phase, the body produce IgG. To detect this antibody is the class of IgM or IgG, we perform 2-ME Wright test. 2-ME means 2-mercaptoethanol. This agent is a reducing agent that causes breakdown of IgM. this agent 2-ME or 2-mercaptoethanol degrade IgM. If we have a sample that have IgM and IgG, if we add 2-ME Wright agent, it degrades all IgM, and in sample we have only IgG. Okay? For example, we have performed Wright test. After adding 2-ME to this test, if we have the same result, the type of antibody is IgG. If we don't have the same test result, the subtype of antibody that produces IgM. Understand? You seem not satisfied.
Satisfied.
I explained to you. For example, it's sample 1 that's in acute phase, okay? Sample 2 in the chronic phase. In acute phase, we have IgM. It's the shape of IgM. It's pentamer. Okay? In the sample 2 in the chronic phase, we have IgG. Okay? We want to see we have IgM or IgG. If the test, right test, here we have this result. We want to see if this test is result from IgG, IgM or IgG. If we use 2-mercaptoethanol, it degrades the IgM, but it don't affect on the IgG. In this shape, you see, if we adding 2-ME and they have the same result, we know that antibody that here is the from class of IgG, and the patient is in the chronic phase of the disease. Don't get it?
Yes, get it, sir.
The second test in the Wright test is Combs Wright test. Sometimes we have IgG from subclass of IgG3, IgG4. We call to this class incomplete or blocking antibody. They are bind to the antigen, but they can't perform the agglutination. See here, the antigen are synthesized with IgG, incomplete IgG. After we adding anti-IgG, it cross-linked between this antibody, and now we have agglutination. In some patients, we have incomplete antibody. The result of Wright test is negative, but we have antibody. To detect it, we use Combs Wright test and adding anti-human globulin to see the result. For this test, we adding AHE to the tube and incubated in 37 centigrade for half or 1 hour, and then centrifuge and check the result. Here, if we don't see any result in the Wright test, we perform Combs Wright test. We add anti-human globulin to detect maybe it have incomplete antibody. And now we see the result compared to this. We can detect that this antibody from this class of antibody, incomplete or blocking antibody. Okay? Any question? You still not satisfied? Have a question?
No, sir.
Okay. Then we want to speak about latex agglutination test, CRP and water. Agglutination reaction, we say we have active agglutination, indirect agglutination, and passive agglutination. In passive, we we particle coated with soluble antigen like latex. Latex is a particle that antigen coated in it. We have passive agglutination. Oh, okay, here we see passive agglutination and reverse passive agglutination. Here we have a carrier molecule like latex. Okay, we coat soluble antigen on this carrier molecule. Why we do this? Sometimes soluble antigen can't be detected. For better detect, we coat the soluble antigen on the surface of the carrier molecule. Then, if we add antisense that have antibody, we can see agglutination. In reverse passive agglutination, we coat antibody on the surface of the particle. Okay? Instead of antigen, we coat antibody and then add antigen. If there is an antigen bind to the antibody and we have agglutination, it's different between passive agglutination and reverse passive agglutination. Okay? C-reactive protein. What is C-reactive protein? C-reactive rise in the response to inflammation. If we have inflammation, necrotic cell in the body, macrophage cell detect this, okay, and then produce interleukin 6. Interleukin 6 effect on the liver, and the liver produce some protein, such as C-reactive protein. C-reactive protein is acute phase protein that from origin of hepatic. What means acute phase of protein? Acute phase of protein are class of protein whose concentration in blood plasma either increase in positive acute phase protein or decrease in negative acute phase protein in response to inflammation. If we have inflammation, our amount of the blood protein are increased or decreased. We call them acute phase protein. If there are increased, we call them positive acute phase protein. C-reactive protein is positive acute phase protein. We detect and diagnose that we have inflammation if the C-reactive protein is increased in the body. C-reactive protein highest and fastest order the protein in this curve. See? In healthy adult, the normal concentration CRP varies between 0.8 mg per ml to 3 mg per ml. In inflammation, we have increase in the amount of C-reactive protein. In mild inflammation and viral infection, we have 10 to 14 mg per ml. In acute inflammation, for example, acute bacterial infection, its amount increased. In severe bacterial infection and burns, it's increased more than 200. In cancer, heart attack, and rheumatoid arthritis, we have also increase in C-reactive protein. In lab, we measure the amount of C-reactive protein to detect inflammation in the body. Methods for detection of C-reactive protein. We can use Elisa, immunoturbidometry, nephelometry, rapid immunodiffusion, and visual latex agglutination. Here today we use visual latex agglutination to detect C-reactive protein. In latex agglutination for CRP, we use reverse passive agglutination. For procedure this test, we add antibody against CRP on the surface of latex. See? We coated this latex with antibody. When we add the patient serum containing CRP to this, we see agglutination. This connection link between this antigen and antibody, and we can detect the CRP in the serum of patient. Today we have this kit to perform this test. We have this traditional kit that can perform this test. We have a control and serum that added to this surface, and we can diagnose the degree of agglutination. We can, if we don't see agglutination, it's a negative. If we have low agglutination, 1+, moderate agglutination, 2+, and 3+, and severe agglutination, 4+. In this kit, we have CRP latex reagent, CRP positive control, CRP negative control, and test slide. In this lab, we see this. And then the last test is rheumatoid factor measurement. Rheumatoid arthritis is an autoimmune inflammatory disorder that primarily affected the joints. Okay? RA is autoimmune disease that occur when the body immune system mistakenly attacks to its own tissue, like other autoimmune diseases. It's a type 3 hypersensitivity. Type 3 refers to immune complex mediated hypersensitivity. What is RF, rheumatoid factor? High level of rheumatoid factor occur in the rheumatoid arthritis. We detect this RF protein to detect this disease. RF is autoantibody in rheumatoid arthritis. It defined as antibody IgM against the Fc portion of IgG. Okay? RF and IgG join to form immune complex and contribute to the disease process. See, it is an IgG structure. Have two portions, FAB and FSC. Okay? Sometimes in the body produce unnormal IgG, and it's not normal. The immune system produces antibody against this unnormal antibody. Okay? We have an antibody, the IgM. We call it rheumatoid factor. Rheumatoid factor is IgM against FSC region of IgG. Okay? For detect in the lab, we use RA latex test for RF latex test. Okay? We add IgG on the surface of the latex. Okay? IgG bind here in FAB and FSC is free here. Okay?
Yes, sir.
It's different from that test. Look, FSC is in the surface and FAB is free. Here, FAB is attached to the latex and FSC is free. And then we add patient serum containing RF, rheumatoid factor. We say that it's IgM, rheumatoid factor is IgM, against FSC region of IgG. Okay? If we have this in the serum, we have see the agglutination in here. It's cross-link between this IgG against FSC region. Today we perform this test. It's the traditional kit, like the CRP test is performed, and we can degree the severity of the agglutination here. If you have any questions.